Hi guys, and welcome back to another F the Noise podcast episode with your host Lauren Fiorenza-Gill. It's so great to have you guys here, and I am so excited to talk about this topic today because it's one that is really useful if you know someone who's going through chemo and about to start, or if it's yourself who's just been diagnosed with cancer and wants to learn how to navigate the world of chemotherapy. So this podcast episode today is super special to me because I want to help you guys build the most ideal, perfect chemotherapy bag to prepare you for this journey. And I have some really good tips of things that I found helpful to just make the chemotherapy journey more comfortable. When you start chemotherapy, it can be really unpredictable, really nerve-wracking, really uncomfortable in the first round because you just don't have the toolbox to help you navigate how to be comfy. And you can, and I'm going to help you guys in that. So before we start, it would be greatly appreciated if you could follow F the Noise podcast on Spotify. I would love it if you guys could rate the podcast and leave a comment on the episodes. Let me know what you think about it. So we're going to start by talking about how do you even know what chemotherapy you're having? How does that discussion even happen? Then we're going to talk about how to prepare for it. So the stage 2 is talking about your plans, your dates, your times, your rounds of chemotherapy. And this will change and vary for each person because obviously every cancer is different, every stage is different, every person is different. So it will really vary person to person, but I'll just talk about how do you even have that conversation, who it is with. And then finally, the main chunk of this podcast is going to be talking about how to build the perfect chemotherapy bag for yourself. So this can be done by a loved one. Mine was built by my mum because I was going through too much at the time. So I didn't even think about Googling how to build the perfect chemotherapy bag or what to include. But my mother, who took the initiative, actually did Google it. And we found some amazing things that I genuinely used every single day. And that chemotherapy bag came everywhere with us. So step 1 is how do you know what chemotherapy you're going to have? So I'm guessing by this time, if you're at this stage, you've probably been diagnosed with a type of cancer. You've gone through a lot of tests. You're probably feeling extremely exhausted, emotionally drained, mentally drained, and just physically tired. That is literally how I felt at that point of discussing what chemotherapy I was going to be assigned to. So what happens is you'll be told what type of cancer you have after all these tests and scans. They'll then tell you what stage cancer you have. So that could be 1 to 4, or maybe there's other different stages for different types. And then you'll be told a treatment plan. And so all of this conversation happens with your consultant. And back when I had it was in 2019, and I was allocated a kind of like cancer nurse, and she was in every meeting, nearly every meeting with my consultant. And she was basically there to offer support. She was there to offer advice if I turned to her and I didn't know what decision to make. She'd give me like context and information that she'd known from her previous experience. Mine was specifically working with my consultant who specialized in Hodgkin's lymphoma and blood cancer and hematology in general. So my nurse had seen a lot of different types of cases of blood cancer. And she, to be fair, she was amazing. She had all the answers to any questions as well as my consultant. But when I couldn't get him, I'd go to her. So from my experience in the first step of how to be told you're going to have chemotherapy and what type, that was done in my consultant's room with my nurse. And I asked to take my mum in as well because, I don't know. I didn't know if I could remember that. I didn't know if I could remember the plan. So basically what they do is they run through a schedule with you. So they'll say, this is the type of chemo that we need to treat your cancer. This is how long it's going to take. They may give you options. So for myself, I had 2 options. I had ABVD, which is about 8 to 10 months. And I think the success rate was about 76%. And then I got given a second option, which was a really intensive, fast, quick route, quite aggressive chemotherapy doses. And that was about 3 months, and that was called BCOP. And I remember the success rate was about 96%. So for me, being 25, being fed up with all these tests, fed up with the fact that I've got cancer, I just went for the quickest so I could get my life back on track. So you may have discussions with your consultant about what type of route do you want to go down? Do you want a less aggressive, less intrusive type of chemotherapy where you can kind of balance your life a little bit? Or do you want a more fast track one which has higher doses, a heavier impact on your body? What I will say in terms of advice is go with what is best suited to you, you know? So for me personally, I made that decision of going with BCOP over ABVD because I wanted my life back. I did not want cancer to take over my whole years of being 25. So I decided to go with the quicker one. And as mentioned in the previous podcast, Can I Live a Normal Life Going Through Chemo and Cancer? It is yes. When you go through chemotherapy, it is so individual. It can literally be absolutely fine for some people and not as aggressive symptoms. For some people, it can be absolute hell where it is just like constantly getting infections, constant pain, constant tiredness. You might have to mix it with radiotherapy. You know, for me, it was somewhere in between. So I'd have absolutely horrendous days where I'd get a UTI. I was like bending over my bed, like crying my eyes out to my mum. The pain wouldn't stop. I kept having morphine. It literally would last for 10 minutes and then wear off. That's how intense the pain was because my immune system was so weak. I just remember the pain flooding through my body and like me literally going, I can't do this anymore. And then, you know, the week after, I'd be absolutely fine. I'd be traveling down to London to see my boyfriend. So it really does vary. And I think don't take anyone's one journey as a one size fits all when you choose your type of chemo. Go with whatever feels right in your gut for you, your life at the time, and the support system that you've got around you. And there's a lot of factors to kind of think about when you're picking your chemotherapy. You know, your work situation, will they support you through it or will you have to stop work for a while? You know, do you have children? Do you have a family that relies on you? And do you have someone that can lift the weight and take the load off for you for, you know, 8 to 10 months? Are you studying at the moment? I remember following a girl and she was studying at the time and she managed to complete her degree whilst going through chemo. So whatever your life is looking like at the time of choosing chemo, really just think about the whole 360-degree photo because that will really help you in terms of which direction you go in if you have the options. You may get presented with just one option and that is the plan, and that's a little bit easier to be honest because then you're on your plan and there's no other what if, oh I wish I'd chosen that other one, you know. So that's a discussion that will happen in a meeting room with your consultant, your nurse, and maybe a family member if you can bring them in. And then the second stage is the plan. So the chemotherapy plan, so that is how long is it? That is how many you have a week or a month, how regular they are. They'll talk through the different types of chemotherapy drugs on your plan. So, you know, I had 6 hours one day and that was like 4 alternative bags of chemotherapy. The next day was a completely different bag, but a repeat of another one. And so what's really amazing in this, and I would encourage anyone going through into this meeting to take notes and write down or see if they can print off. I was luckily given this kind of like sheet which had the full plan, all the information, what each drug does, and just basically I could always refer to it. So if I was confused one day why I felt a certain way, I could track it back to that certain chemotherapy bag and go, oh my God, that made me feel nauseous. Oh my God, I know I'm going to throw up. So I need a very strong anti-sickness tablet. And so that was really useful because you can start to track your side effects against each chemotherapy bag. So I'd recommend that. So yeah, they go through the date of your chemo starting, the cycles, the different types of bags, what time you've got to be there each day, you know, if you get any rest time off, which is super important to know to recover and heal. And to be honest, that's a really simple one. So, you know, you've gone through all these pre-diagnosis stages, which is so unplanned. You know, you're going for a scan here, you'll get blood tests there, you're maybe doing your fertility treatment before, you know, and all of that, it just feels like a world of chaos. And then you get this plan. And to be fair, I felt so relieved when I got my assigned chemotherapy and I got my plan, because then we had something tangible to hold on to and something that I knew was going to fight the type of cancer that I had, like something actually set in stone. And there was a relief element to it. You know, it sounds so weird because it's like, oh God, I'm starting chemo, but it was the most guaranteed plan in my life that I'd had for a very long time, since like the pre-diagnosis. So I just felt very safe. I felt very confident in my consultant's hands. I felt like I had a great relationship with my nurse. My family could then all get sent the plan, which I did. I sent it to my dad, I sent it to my sister, my mum, my family. And it was like, this is my plan of how I'm going to get better. And I've, you know, if I've committed to anything, you know, I spoke about in another podcast, like committing to friends' birthdays and stuff, just to let you know, I might not be able to, because this is how long my chemotherapy is going to go on for. And who knows what will happen after that. So having a plan just felt like I was equipped with like certainty, and that was very relieving for me. And then before you know it, it's time to start, and it happens really quick, guys. Like I know some days for me personally felt like forever. Like, oh my God, 6 hours of chemo one day felt like just a lifetime. But, you know, I just felt the whole thing like really did flow by. And it's like you kind of gear up for this one big day, which is your start date. And I remember, you know, being like, okay, I'm ready. You know, we're going to go for it. This is the starting point of the journey that's going to heal me. And, you know, you kind of rev yourself up and you get a little bit anxious, but you're ready. I was just so ready. I just wanted to start this journey. You're equipped with this information. You kind of know where your path is for the rest of the year. And then you start. And then this is where I'm going to talk to you about the essential chemotherapy bags and bits to put in the bag that helped me so much. So myself and my mum, we did this YouTube video, and you can probably still find it on my YouTube channel. Actually, the link's in my Instagram bio at Lauren Fiorenza Gill. And we did this YouTube video about how to build the perfect chemotherapy bag. So if you want to have a look, I really highly encourage it, because you've got like a parent daughter kind of chat on there. It was just me, my mum. We were in Teenage Cancer Trust ward. I've been admitted to hospital, and I said to mum, oh my God, I'm so bored. I want to record this reel. I want to help people. Let's do a video together. And you can tell me how you found out this information of what to bring, and then I can basically talk about why it helped me. So that's on there if you want. But I just wanted to do a podcast episode to kind of sum it all up, because there's some really amazing things in there that are lifesavers to me. I also want to say before I start this, we actually built the bag, oh God, I think it was like round 2 of chemotherapy that I had. So it was like after the first round, after seeing what sort of things I needed on a daily basis, that's how we built this bag. Because we didn't have this level of information to start with. Like the hospital don't give you this, bless them, because they're doing a billion other things, or like sorting your meds out and stuff. So this was really from experience. So if you want to get your notepad out or your iPhone notes just to jot down these like key product tips that really helped me, please do it now, because there's going to be quite a few recommendations and I want you guys to capture everything in one go. Obviously you can always listen back to this, but let's just jump right in. So number 1 essential chemotherapy product, a chemotherapy bag. So my mum got me a bag. I think the first thing that she says in this like how to build the perfect chemotherapy bag video is she went on Google and she typed in things for chemotherapy. And the first thing that came up with this was this like tote bag, and it was leopard print, and it had fluorescent writing on with like gold rim around it. And it was like, she is fearless. And she surprised me with it. And it was just such a beautiful thought, because I would never go for that style normally. Like I'm quite a minimalist color person. So I go for like my nude tones or my black or my white. I don't really venture into like bold colors. But I tell you what, guys, like go all out, get a bag that is completely the opposite of to what you would normally have, that maybe has like a positive quote on. The tote bag is the size that we got, and that was a pretty perfect size, to be fair, to fit everything in. But go bigger. If you want to go bigger and you want to bring like a duffel bag, bring it, because I took this bag everywhere with us. My mum was kind of in charge of making sure it was packed. I also remembered, and it was just our absolute go-to golden bag. Like that went everywhere with us. Whenever I was admitted to hospital, it would come with us. Whenever I went for chemo, it would come with us. So there's nowhere that we went without that bag. So make sure the bag is bright and colorful, or has like a message on, or something that just makes you feel positive every time you look at it, because that's going to hold your chemotherapy essential products that are going to make your life so much easier. And then what I'm going to do now is I'm going to go through by like category of things that you need. The second thing, which I would arguably say is the most important thing that you'll ever need, is a folder. So my mum got this folder. It was a really big folder. It had lots of different sections in, and this folder was everything. This was our like holy Bible. So this folder had in all my medication treatment plans. This folder had in my chemotherapy plan. It had our car parking pass in. It had emergency numbers. It just had all the important documents that we got given from the start in one place. So if I needed to know what meds I was taking next, or I was asleep and mum needed to know, she could just open that folder, and it was brilliant, guys. So I highly, highly, highly recommend to get a folder. Get any style you want, but just make sure it's big enough, because you're going to want ones with different sections in, so you can label one medication, another one car parking pass, another one emergency contacts, that sort of thing. And that never left the chemotherapy bag either. And also if I wanted to have a read as well, because it takes time to process information, so I would always go back to the folder and just reread again, like, oh yeah, that's the treatment plan, or that's how many days I've got to go. It was brilliant. You can even put calendars in there, like medication checklists, whatever you want, put it in that folder because it is a godsend. I'm going to say my third and fourth must-haves are literally on par with the folder. So get the folder first because that's your go-to for everyone, anything. Anyone can pick that up. But this third and fourth was everything to me. And you know what, guys? I still use them now. Like, I still have the same product that I used now, and I actually left them in a cafe the other day and I was on the verge of tears because that product holds so many memories and I can't let it go. And there's just brilliant. So, and the fourth one as well is something that I just can't live without. So I'll put you out your misery. The third one are noise cancellation headphones. I had these Sony ones and they had like the over the head, they're big ear headphones. And I tell you what, I literally still, I use them every single day. And the fourth one is a neck pillow. So, you know, like when you go on the flight, you have like a neck pillow, memory foam sort of one. I don't know if it's the memory of being just like ultimately the comfiest I've ever felt in a hospital bed, which sounds crazy because they're not that comfy. But my body and my brain signals just know that as comfort. So if I'm poorly, I get a neck pillow, my noise cancellation headphones go on. And if I'm flying and I need to cancel out the noise cancellation, neck pillow. Those two paired together are everything. Basically, I would use the noise cancellation headphones because, as you can all imagine, I'm sure if you've been in A&E or you've been for an appointment, hospitals are loud, but when you're staying there for weeks and you've got chemotherapy and you've got the sound of the chemotherapy like drip going in you, it does make a sound. And then also you've got other people who are really going through it. Like, I remember there was one time when I was having chemotherapy and I was quite calm. You know, this is like my third round, so it's not my first rodeo, and I'd kind of got my routine. And there was just one lady who just was having the worst time and she was screaming and it got really serious. And she was in so much pain and it literally, I was like crying because it was so upsetting. There was doctors running in, they pulled the emergency alarm. Like, all of that in hospital is very likely to happen. You know, when you're in your own house and it's like the likelihood of someone near you or in public having that happen is not that likely. It's like 90% likely to happen in a hospital, right? So noise cancellation headphones are key. By the way, the lady was fine. I saw her a few days after that and she was okay. But it is distressing and it's really upsetting and you really feel for other people going through it. And so that's what I did. I would have my noise cancellation headphones on. I'd be watching vlogs. I'd be watching like, you know, whatever on social media or like a Netflix show or something like that on my iPad. And then also I'd be admitted to hospital quite a lot because, like I said in previous episodes, I'd catch infections all the time in like the second, third week, and they were really bad. They were like UTI infections. And you know when you get one and it's just like, it's sore, it's like stabbing, times that by 1,000 where like you can't actually physically walk. Like, that is how bad it was. And I was just like screaming and I was just like, please someone do something. And I was always in and out of hospital and it would be for multiple days sometimes where I'd have to stay in. And also my injection regime was I would have my chemotherapy, then I would also have to have injections that would help my body fight when it had no immune system. So I was being injected at 1 a.m, 4 a.m, and 6 a.m. every single time I was in hospital. Guys, I am a morning person. I am not a late night owl. I love my sleep and I'm a morning person, but in the sense of 6 a.m. earliest, unless I'm catching a flight and I'm very excited, then it can be whatever time. But I get up at 7 pretty much most days, maybe 6:30. That's a sweet spot for me. But you get me up at 1, 4 and 6 a.m. It is so exhausting, especially because you're going through chemotherapy. It's a lot. So if I could get any chance of a nap in between those sessions of injections, noise cancellation headphones were going to help me. And also you get people literally being like pushed into your ward in the bed next to you or opposite you at any time of day. It could be 3 a.m. and a new patient's just been rolled in, you know, because of XYZ. Or it could be midnight, or it could be 12 p.m. at lunchtime. Hospital settings are so unpredictable. And so what I would encourage anyone to do who's starting chemotherapy and listening to this podcast is make your life a little bit more controllable and like have a little bit more control by doing things that you can control, because you cannot control and predict anything that happens around you. Just in that setting alone, I'd arguably say it's one of the most unpredictable settings. And so if you can control your space, if you can control how you react, it really helps. So noise cancellations, get yourself some if you haven't already got any and you're about to start chemo. So as mentioned, because of all the other reasons where, you know, you're kind of in and out of hospital, the lights are super bright, they're waking you up for injections possibly at 1, 4 and 6 a.m. You're going to want an eye mask to pair with that gorgeous neck pillow and gorgeous noise cancellation headphones, because it just helps you sleep. And it also helps regulate your body. Again, going back to those things that you can control, and regulating your body to know when it's morning versus when it's night is a really good way of just getting yourself in a routine. Keeping your body remembering that normal time schedule that you would normally be on if you weren't having chemo, I think is really important. And so I used to put my eye mask on when I was ready to go to sleep. I'd put this amazing meditation on called Yoga Nidra. My friend Mumtaz, she is amazing. When I was telling her that I was starting chemotherapy, she actually recorded this voice note of her doing a Yoga Nidra meditation. And essentially what Yoga Nidra is it just is like a body scan meditation. So I can't remember if you start from your top of your head with your facial muscles, relaxing them, and then you work your way down each area of your body at a time. So you'd go like the facial muscles, you go to kind of your throat chakra, your neck, just breathing, softening the space. You'd go right down your arms to your fingertips. Then you bring it back to your chest area. And essentially what it does is, A, it calms your mind because you're going into a deep sleep, and you're actually consciously preparing the body to relax. And B, it really relaxes your muscles, and you're focusing on each area to reduce inflammation and calm your body and calm your nervous system. For those of you who don't know, I am also trained in meditation, and I'm a meditation teacher, and I have clients from corporate clients like Deliveroo, Benefit Cosmetics. I've held meditations at Paramount. And I also have some one-to-one clients and do group settings as well. It'd be great to know from you guys if you would like me to do some meditations for you. I'm also quite interested to incorporate meditations as like podcast episodes. So essentially, if you feel like, you know, with this podcast and you're looking through each episode, you're getting tips on how to navigate through cancer and chemo. I really want this podcast space, F the Noise, to literally be effing the noise around cancer. So, you know, cutting through all the noise and getting to the facts of what you need to know that people don't tell you, but also cancelling the noise around you to focus on yourself more. And I feel like meditation, because I'm experienced in it and I do teach it and I love it and I do it every single day, I do really think the practice could benefit other people. I would love it if you guys are interested to comment on the YouTube video or DM me on Instagram or comment on this episode and just let me know if that's something that you're interested in, because I'll do it if you are. Let's talk neck pillows. Hospital beds aren't the comfiest. So my mum bought me a memory foam neck pillow. Genuinely think it was like £3-4 from Wilko. And they're brilliant. You can get them on Amazon, and just make sure they're like a kind of memory foam one, so it's nice and comfy. It's not too tight around your neck. And you would literally find me in hospital just sat upright, fast asleep, because I had the neck pillow and the noise cancellation headphones on. That was my ultimate comfort duo. So get yourself a neck pillow. You know, you might have chemotherapy in the daytime and you might feel exhausted from one of the chemotherapy bags that they give you. So have a neck pillow, because then you can just fall to sleep and you don't have to worry about getting comfy. As part of the ultimate comfort package, if you like, get yourself a really fluffy throw. My favorite ones are from Wilko. They do these throws for like £15, sometimes £10 if they're on offer, and they are just the ultimate super soft throws. And just get yourself one, because then you can just snuggle up on your little chemo bed or chair, put the little leg rest thing up, and then you can just doze off and sleep. And then by the time you wake up, hopefully your chemotherapy's done and it's the end of the day and you can go home. So I used to have the same throw, like obviously washing it very regularly, but I used to take that throw in as like literally my comfort blanket. Get yourself a throw that feels soft. It's really like comforting, and you just feel like it's your security blanket, because it's the best thing ever when you just make your space feel like your home. Which now brings me nicely on to how to personalize your space. So as mentioned, when you're going through chemo, you are literally living in and out of hospital. You are either at your parents', you're at your own place, you're in hospital. So think about how you would make a house a home, right? You'd have photos of your family. You'd maybe have like ornaments that mean something to you. I don't know if you're watching this podcast, but as you can see, these are my creature comforts. I love crystals, and so I literally took my clear quartz crystal to hospital all the time. I love candles, can't take them in hospital sadly, boo-hoo. But plants as well, like this is my little artificial plant. If you're watching, you can see it now, and it's just a really cute fake eucalyptus. Obviously, taking in real plants in hospital isn't going to be that feasible unless you get flowers, which is obviously brightens up your day and they're magical. The next item I would recommend is a water bottle. So of course you get water given to you in hospital. You've got vending machines, you've got cafes. They also had a nice ice jug of water that they kind of went around and filled your cup up where I was having chemo. But a water bottle is great because A, it's your own, and B, there is never too much water that you can have when you're doing chemotherapy. One of the things I did before I started chemotherapy, which I'll probably talk about in a different podcast because there's so much information I got from this lady. She was like a holistic nutritional therapist, but also who specialized in holistic treatments, aka if you weren't having chemo and you wanted to go away from the Western medicine route to the holistic side and treat it naturally. I did have a meeting with her to try and understand that side as well, because essentially I wanted to pair holistic therapies and healing with Western medicines of the chemotherapy to help my immune system stay strong, help aid my recovery when I finished the journey, and just help keep my mind clear. And so one of the things that she told me was the chemotherapy, because it's so strong, it's in your body, flush it out, drink more water than you think you need. So I got a litre bottle of water and I would try and get through that or two a day. And sometimes I did not want to drink it. I was too tired, but my mum was there, or the nurse, and she's like, drink some water, have some water. And it genuinely is what it says on the tin. It just flushes any like bad toxins in your body out. And it just helps your body heal. Water's so good drinking, even if you're not doing chemotherapy. I try and get my 1 litre of water in a day. It's just brilliant to do when you're having chemo because it just flushes any bad stuff out of your body. Another great thing that my mum constantly kept on hand, she is a childminder, so she's used to this, is hand sanitizer and hand wet wipes. So she just got the Johnson's Baby, or like a brand from Wilko, which was 100% pure kind of natural hand wipes, and they were like baby wipes. So if they're good for a baby, they're good for me. And the importance of getting ones that are natural, I think it was like 100% water, she said, or something like that. It just sterilizes any kind of dirt, obviously, and cleans your hands. They were great for my face as well, because I would have makeup on that I just want to take off halfway through chemo because I was too tired. And so one of the best things about them being natural is because your skin gets quite sensitive, or at least mine did, from the chemotherapy. So to have natural hand wipes that I could use on my face, my hands, my body, it was just being conscious of the sensitivity of my skin and just doing nothing else to cause distress to my body that was unnecessary. So I highly recommend them. Hand sanitizer, we've all been through COVID. It's good for you when you are in hospitals. It's good for you on public transport. It's great. You can even get cute little ones with like keychains on your bag. So if you put it on your chemo bag, you'll never forget it. Another great thing that really helped me when I talk about drinking water and really struggling was straws. Now, these are so underrated, but have like a massive impact. I didn't want to just drink out of like a massive water bottle or a glass. It all just felt too much. Don't ask me why. I don't have the answer to this, but straws really did, and they still do, help me drink water. I don't know if it's because there's less water coming through. I don't know if it's the act of having a straw, but it worked for me. If you're struggling to drink water, even if you're not going through chemotherapy, try reusable straws. Lifesaver. One of the things I'll talk about in a different podcast, which really was a massive game changer for me, was how to have my chemotherapy. So I know that sounds strange because obviously it's being, injected into you, but there's 2 options that I had, and I didn't realize really that there was a second option. I didn't know what that meant. What I initially went for was a cannula, which is, kind of like an injection in your hand or around your wrist, and they just kind of pump the chemo into you that way. Now, the problem with cannulas, and the problem that I personally experienced, was I have quite small veins, and it was actually very traumatic to find a vein to put the cannula into. And I didn't mind going through the chemo and the side effects, but that was the bit I was dreading each time I went into hospital before my chemotherapy session. I was dreading trying to find a vein. I was dreading being poked and prodded, and it was just really, really painful and really uncomfortable. And you are adamant to go for that. The other option, by the way, is a PICC line, which is what I ended up going to. Now, a PICC line is a cannula that stays in your arm. I don't know if you're watching the YouTube version of this or watching the Spotify video. It just goes in where this little compass tattoo is on me. I had the compass tattoo to cover my little scar. And when I say scar, it's tiny. But a PICC line is basically the cannula stays in you and you have a bandage over it, gets cleaned, and you just hook up to the chemotherapy. That's how that works. So it's non-intrusive. It's one little minor operation that just gets the cannula in. Once it's locked and loaded on your vein, that's it, done. So I'm sorry if this is like too much detail or if you're squeamish, but it's matter of fact, like this is how it works. So I was like, I am not living with a cannula attached to me because I'm already dealing with cancer. I don't want another thing to feel like I've got cancer. I don't want to live with that. And I was very stubborn and I didn't explore it. And then it just all got too much with the cannula. So I ended up going for a PICC line. It was the best decision I ever made throughout my whole chemotherapy journey. That is a personal preference and personal experience of mine, and I'll talk about it in another podcast. But if you are opting for the cannula first to see how you get on, where it's put in, taken out at the end of each day, if you're struggling with your veins and if it's becoming quite difficult, a tip that I got was a hot water bottle or heat over your hand or over your wrist of where they're going to get the vein. Basically what the heat does from, say, a hot water bottle, or my mum got me these from Flying Tiger. They were like a little heat pad with like little gel heat balls in that you just pop in the microwave for like 30 seconds, heats it up, just put it on your wrist or your hand. What that does is it enlarges the veins to then make your veins more accessible to get an injection or to get the cannula put in. And it's easier because they're there, they're ready, they're expanded. That was a really good hack and a very good trick that we did. So we got a hot water bottle, which is also very comforting. I used to hold that under me, over me. I used to get very cold during chemotherapy. I'm not really sure why. I think it was a side effect. Some people get very hot, but I used to feel freezing. So I had a hot water bottle, not just for my veins to enlarge them before I had the PICC line, but to keep really warm throughout. And they do give you electric blankets. They did at my hospital and on my ward. But, you know, you have to wait for one to become available, or it's a little bit of another ask. So we just decided to, again, take back that control, get a very hot water bottle. And I swear to God, I live with mine. I absolutely love mine. Another top tip for remaining present throughout the experience of chemo and taking control of understanding yourself is we had little notebooks. So my mum got me a really good one. It was very small. I think we got through 3 of them in like the second round. And it said like good vibes only on the front. It had like a rainbow color, just anything that you surround yourself with, just make it kind of vibey and uplifting because it does help your morale. These little notebooks were great for journaling. I journaled in my iPhone notes like every single day. Whenever I could, I just journaled everything because I wanted to remember it all. But it was also for the nurses to input any experiences, like if I had a side effect or reacted to something. It was for my mum to keep track of my medication. It was for me to kind of just keep track of what I'd been through in that day. And so anyone could pick it up and fill it in. And it was quite a collaborative thing, but it was really nice because we got through them so much. So journals were really great. Even like a little notebook is fine. It does the job. And it just helps you jot down all your thoughts and notes and reminders. For example, if you don't have a car parking pass yet, it just reminds you certain times or like how much certain prices of the car park are. And then you can just refer to that journal and keep it in that chemo bag. It is your godsend everything bag. So just touching quickly on car park passes, make sure you bring change, and that's like in a little purse in the chemo bag, because you need change in hospitals for vending machines if it's late at night and all the cafes have closed. You just need change for little things that you don't think about. So highly recommend bringing a little purse, and it's just got a few £1 coins and stuff in, maybe some 50p's, maybe some 20s, but that really is helpful to know because we didn't know. And I think the machine had broken and my appointment before I'd started chemo had gone on a little bit longer and I had to pay more, but I didn't have change. So it was a bit of a struggle. So just remembering change is still prevalent in hospitals. So bring a little purse of change. Another thing is like a little mini makeup travel size bag. Although it might sound silly to like put makeup on when you're doing chemotherapy, it was a big part of me on my good days or before I went for chemotherapy to dress up. So I put on my favorite tracksuit bottoms. I had this like pink set that were like a little jumper and trackies, and it just made me feel really great going into something that wasn't so fun. So I had my little comfy tracksuit set with my fluffy socks. I had my little travel size makeup bag. As mentioned, sometimes I would literally be in hospital for weeks. And I remember I was in the hospital for like a week and a half one time, completely unpredicted. I had a little makeup size travel bag where I would have like a little nail varnish to paint my nails if I wanted to. I would have like my little concealer stick. I'll talk about makeup in another podcast because there's certain brands and makeup routines that I did for self-care that were great for sensitive skin. So I'll talk about that in a different podcast where we can go through my self-care routine and the products that made my skin feel great without affecting the sensitivity of it. Having a makeup bag just makes you feel good inside out. On my good days, I'd wake up before I had guests and put a little bit of mascara on, even though I had like 3 lashes hanging on by a thread. So just highly recommend like a little travel size makeup kit. And I'm going to talk about my nose now, which might sound strange, but my nose was incredibly sensitive. After day 1 of my chemo, where I had 7 bags of chemo, there was one chemo bag that made my sinuses and made my nose just tingle. This like tingling sensation would come up through my nose, go all the way across my eyes, go all the way down the back of my throat and my mouth, and then shoot up to my brain, where it felt like I was getting brain freeze. And it was so painful and so uncomfortable, and it was really unbearable. Like, I remember being on the verge of tears because it was just the most surreal side effect of a chemotherapy drug. And this is day 1. So imagine how on my first round I thought the rest was going to go. One of the remedies that the hospital told us to try was ice lollies or crushed ice. So my mum used to bring some like homemade ice lollies. One of the things that me and my mum tried to do consciously, bearing in mind I kind of moved in with her, she'd like taken time off work, was have a healthy lifestyle alongside chemotherapy to help my recovery. So she used to make me natural homemade ice lollies, and boy, oh boy, did they do the trick. When we didn't have them, we just used to go to the cafeteria and get some like little lemon ice lolly. Sucking on that ice was something else, let me tell you. It stopped the tingling, it calmed the senses, and it calmed me. So I highly recommend, and you can thank me later for that one. Another thing with my nose was the sensitivity around hospital smells. So not that it smells really bad, but you know, hospitals do have a very sterile, clean smell because of the nature of what they are. Lots of like anti-bac strong smells, which I actually don't mind now. I actually strangely find hospital smells very comforting, and I don't know if that's a good or bad thing, but when I walk into a hospital, I'm like, there's that smell of cleanliness. But when I was going through it, and I was literally practically living in hospital for weeks because I got an infection through chemo or something like that, I would have this like perfume scented natural moisturizer that a friend had gifted me, and I'd just put it underneath my nose, and I'd also put it on my hands because it was actually a body moisturizer lotion, and it just smelled like the seaside. And I literally use that every single second of every day. Like whenever it had dried up, I'd put some more on because it just helped take my brain out of a hospital for a minute and put me on a seaside. It was brilliant. So if you can find something that's like your favorite smell that's calming, maybe lavender, maybe, you know, eucalyptus or the Brighton Sea or cotton sheets, find what smell makes you relax and makes you feel fresh and clean and lovely, and see if you can get like a completely natural moisturizer for it, and just put it a bit on your nose and underneath and your hands, and it just makes you feel great. Another thing that I still struggle with now, and I don't know how I forget, I have a remote one now, is a phone charger. There's plugs everywhere in the hospital. You can plug it in behind your bed, in the waiting room, behind reception, if they let you. A phone charger is key. I think I ended up having 3 because I lost most of them and I forgot to bring them, so I had to buy new ones. But when you're in hospital for so many hours a day or weeks on end, as mentioned, you want a phone charger. So just bring a portable charger tablet, have that on charge, and then also just bring a phone charger that you can plug in because you'll need it. Whether you've got a tablet, an iPad, a phone, whatever it is that you're watching Netflix or something on, you're going to not want it to die mid-chemo, trust me. So get yourself a phone charger. Let's talk tablets now. So I was on about, I'm not even joking, about 15 tablets a day. Some were horse-sized tablets, some were small tablets. And the reason why there's 15 is because they counteract each other in a weird way. So you'd have a strong steroid tablet, but then you'd have another one that counteracts that and protects your stomach lining. And then you'd have another one for this. And so I actually feel like gagging at the thought of tablets because I've really struggled every morning to take them. And the thing is, I had to take them all at the same time at a certain time. So 15 tablets a day just makes me like, but I knew that it was for the best. So basically my mum, love you Sue, got me this tablet organizer. It's basically like what you'd use for supplements as well. And it had Monday to Sunday, and down the side it had morning, noon, PM and evening. And my mum, bless her, she would like take the liberty because she was off work looking after me to like organize them. But even if you're doing it yourself, it's just oh my God, it's just heaven to have, because you literally don't want to think about that on the daily. You want to organize it one day every week on a Sunday for the week ahead. And it just keeps all your tablets in check. You know exactly what you're taking when, and it just helped massively. And also nurses will know as well, so they can check, and we cross-checked everything with them and with the sheet, which told me my medication plan. And having that little medication organizer was heaven sent. It was the best thing we could have ever done. So I highly, highly, highly recommend that. And finally, one of my favorite subjects in life is food and snacks. So of course you have cafes. Of course you might have a Starbucks or a Costa there. Of course you have a menu that they give you in hospital. But there's nothing more comforting than a cup of tea and your favorite snack. So I again tried to keep healthy just to look after my body holistically. So my favorite snacks were rice cakes coated in dark chocolate, Trek bars for slow release energy, protein. My mum also used to make like fresh juices, so whenever she came to visit me in the morning, we'd have that. But it's really great to just have your creature comforts. And so whatever your favorite snack is, try and, when you're having a home day, prepare and plan and pop them in that chemo bag. Then you don't have to think about it, and it's ready and it's there for when you need it. And there you have it, guys. That is basically my top picks for an essential chemotherapy bag. I highly recommend you create one. It will become your creature comfort. It will become a natural thing where you just pack it weekly with what you know you love, and it will save you so much time. You'll have everything you dream of to make the experience easier. And I just thought I wanted to share this with you guys because it took me a few rounds to really figure out what I needed. And I wish there was somewhere like a podcast like this episode, which would have just prepared me a little bit better for that. I hope you found that helpful. And I would love to know if you've got any additions to that. So don't forget to leave a comment on this episode telling me what your favorite creature comforts are going through chemo. I'd love to know. And as always, don't forget to rate and follow this podcast, @FTheNoise_, and follow us on socials. We're on YouTube, we're on Instagram. I would love to connect with you guys, and thank you for being part of this F the Noise cancer community. I love you all so much, and I can't wait to talk to you in the next episode. Much love.